Gentlemen, let me ask you something that most men over 60 silently struggle with but rarely dare to say out loud, even to their doctor. Why do you wake up 2, 3, or even 5 times a night just to urinate? Why is your stream getting weaker? The feeling of incomplete emptying getting worse? And why do you always have to plan ahead where the restroom is every time you go out? And more importantly, if I told you that these issues aren't caused by aging, but by 5 daily habits that are quietly irritating and inflaming your prostate, would you believe me? In the next few minutes, I'm going to show you 5 simple habits that have helped thousands of men over 60 reclaim peaceful sleep, a stronger urinary stream, and a sense of freedom they thought was gone forever. Stay with me because the first secret is going to surprise you. I'm Dr. Emily Carter, a board-certified urologist in the United States with more than 14 years of experience treating circulation issues, prostate problems, and men's health after age 50. Over the years, I've walked alongside thousands of men who once believed that nighttime urination, a weak stream, or daily inconvenience were simply the destiny of aging. But that's not the truth at all. When you understand your body correctly and adjust just a few small habits, your prostate can recover, your sleep can become deep again, and your confidence can return stronger than before. And today, I want to share that with you in the clearest, simplest, and safest way possible. Most men over 60 believe that these uncomfortable changes, nighttime urination, a weak stream, that heavy pressure in the lower abdomen, are just the body getting old. But after 14 years of treating this, I can tell you one simple truth. You are not broken. Your body is not betraying you. It's simply sending signals that no one has ever helped you understand properly. This isn't a matter of being strong or weak. It's not a sign that you're declining. It's the result of changes in circulation, inflammation, your circadian rhythm, and small daily habits that you can easily adjust. I meet so many men just like you, men who once felt embarrassed to talk about this, who lost confidence, or felt frustrated when their life revolved around the bathroom. But with just a few simple changes, they regained the freedom they thought they had already lost. And before we dive into those 5 habits, I want to understand you, the person watching this video right now. Leave a comment below and tell me where you're from and how old you are. Each region and each age group has different habits, and I want to make sure that today's advice truly fits you. Before we get into the 5 habits, I want to help you understand what's really happening inside your prostate, because once you understand it correctly, you'll know how to control it instead of letting it control you. Imagine the blood vessels and tissues around your prostate as small, soft tubes. At age 30-40, they're flexible, elastic, and the flow is strong. But after age 50-60, due to inflammation, stress, lack of movement, and hormonal imbalance, these soft tubes stiffen, narrow, and lose nitric oxide, the compound that helps blood vessels relax and open. When those soft tubes narrow, the flow weakens. Your bladder becomes more sensitive, nighttime urination increases, your stream gets weaker, and that heavy, uncomfortable pressure in the lower abdomen gets worse. The worst part is, this process happens silently for years, leading many men to mistakenly think it's just aging. I once had a patient named Michael, 67, from Arizona. He told me, "Emily, I used to think my body was breaking down. I couldn't sleep. I hated going anywhere far from home. And I felt 10 years older." But when I explained to Michael how circulation works, how blood vessels stiffen, and how inflammation triggers prostate irritation, the first thing he said was, "So the problem isn't my age, it's how I've been treating my body." After just 3 weeks of applying the habits I'm about to show you, Michael came back with a completely different smile. His sleep improved, his urinary stream strengthened, and that heavy pressure almost disappeared. And this is exactly what I want you to understand. Circulation can improve, inflammation can decrease, and your body can recover. The first habit may sound simple, but it's one of the biggest reasons prostate issues get worse over time: how you drink water. Most men over 60 do this. In the morning they drink very little, at noon just a few sips, and then in the late afternoon or evening, when their body is finally thirsty, they chug large amounts of water. The result? You wake up 3-5 times a night to urinate, and this puts even more stress on the prostate. Biologically, when you drink too little throughout the day, your urine becomes concentrated, darker, and more acidic. This irritates the bladder, inflames prostate tissue, and causes that slight burning sensation, the weak stream, and the constant nighttime urination. But simply changing when you drink water can reverse everything. Drink steadily in the morning and afternoon, especially one large glass right after waking. Reduce water intake from 6-8 p.m. onward. A study in the Journal of Urology found that men over 60 who follow this strategy reduce nighttime urination by up to 41% within just a few weeks. I remember a patient named George, 72, who used to wake up 4 times every night. He once told me, "Emily, I haven't slept through the night in years." After just 10 days of using this smart hydration routine, drinking steadily in the daytime and reducing water in the late evening, George returned and told me, "Last night, I got up only once. I feel like I'm 15 years younger." This isn't magic. It's simply how your body responds when you give it the right signals. The second habit is one of the most powerful natural medicines for the prostate, and you don't need equipment or a gym for it. It's simply taking a light 10-15 minute walk after meals, especially after lunch and dinner. It may sound simple, but here is the science behind it. After you eat, your blood sugar rises. When you sit down right away, high blood sugar increases inflammation, reduces circulation, and causes the entire pelvic region, including the prostate, to receive less oxygen and fewer nutrients. But when you walk for just 10-15 minutes, even if it's just around your home or down the hallway, blood flow increases, blood sugar stabilizes faster, inflammation goes down, your pelvic floor gets more oxygen, the prostate relaxes instead of tightening. A study from the University of Sao Paulo found that men over 65 who walk after meals have a 35% lower risk of moderate to severe BPH symptoms. And what matters isn't just the science, but the emotional impact. I remember a patient named Jonathan, 69, who always avoided evening outings because he feared having to look for a bathroom all night. When I suggested he take a 15-minute walk after dinner, Jonathan looked at me and laughed. "Emily, you really think just walking will help?" But 3 weeks later, he came back almost speechless with excitement. "For the first time in years, I watched an entire movie last night without getting up once." Walking after meals doesn't just help your prostate. It restores freedom, rhythm, and confidence, things many men over 60 believe they've lost forever. The third habit is something many men feel shy or uncomfortable talking about. Yet, it's one of the most powerful natural factors for protecting the prostate. Maintaining regular sexual activity, including ejaculation. I know this topic can feel sensitive for many people, but the science is very clear. Your prostate constantly produces fluid. If this fluid sits for too long, dead cells and toxins accumulate, increasing inflammation and making the prostate react more intensely. Ejaculation is your body's way of flushing the system, just like pressing the flush button. A Harvard study that followed more than 10,000 men for 20 years found that men who ejaculated at least 21 times per month had a 33% lower risk of prostate cancer. But it's not just about biology. It's also about emotion, connection, and the feeling of still being in your prime as a man. I remember a patient named Robert, 71. He told me, "Emily, I had almost given up on that part of my life because I thought age had taken everything away. But after understanding that sexual activity reduces inflammation, boosts circulation, and improves emotional well-being, Robert slowly opened up to his own body again. 2 months later, he returned and said, 'I feel alive again. Not just my prostate, my whole spirit feels stronger.' If you're having difficulty maintaining this habit, that is completely normal, and it's absolutely nothing to be ashamed of. Leave a comment below and tell me what you've been struggling with. Low desire, difficulty maintaining, or feeling hesitant because of age. I read every comment, and I want to give the most personalized advice for each situation. The fourth habit is something you encounter every single day, yet most men have no idea how strongly it affects the prostate. What you eat can either reduce inflammation or make everything worse. The prostate is extremely sensitive to inflammation. Some foods sharply reduce inflammation, helping prostate tissue calm down, improving urinary flow, and lowering that heavy pressure. But other foods, especially sugar, fried foods, and processed red meat, quietly make things worse without you even realizing it. Today, I want you to focus on 3 golden nutrition groups for the prostate. 1. Lycopene. A powerful antioxidant. Cooked tomatoes, watermelon, pink guava. Many people think tomatoes are healthy because they're rich in vitamins. But the real secret is lycopene, a compound that reduces oxidative stress inside prostate tissue. Important tip: lycopene is absorbed better when tomatoes are cooked, such as tomato sauce, soups, or stewed tomatoes. One study showed that men who ate cooked tomatoes twice a week had a 28% lower risk of prostate cancer. 2. Zinc. The mineral that balances male hormones. Zinc is the prostate's silent protector. It's found in pumpkin seeds, walnuts, seafood, chicken, eggs. Zinc helps stabilize testosterone, reduce inflammation, strengthen prostate tissue. Men who are low in zinc often experience low libido, weak urinary flow, and afternoon fatigue. 3. Sulforaphane. Anti-inflammatory and detox support. Cruciferous vegetables. Found in broccoli, cabbage, Brussels sprouts, kale. Sulforaphane activates the body's cleanup system, helping remove damaged cells and slowing prostate enlargement. Many of my patients notice that simply adding broccoli 3-4 times per week drastically reduces lower abdominal pressure. Real patient story. I remember a patient named Arthur, 66, who had a very inconsistent diet. One day, a processed meat sandwich, another day, fast food, and almost no vegetables. He came to me with symptoms of 3-4 nighttime urinations, lower abdominal heaviness, and frequent feelings of incomplete emptying. When I suggested Arthur change his diet for just 30 days by adding tomato sauce to lunch or dinner, eating 1 handful of pumpkin seeds daily, adding broccoli or cabbage to his meals, he said, "Emily, can food really fix this?" But 4 weeks later, Arthur came back with a completely different smile. He told me, "For the first time in 2 years, I only woke up once last night, and that heavy pressure has almost disappeared." Food truly is natural medicine when you use it the right way. The final habit, and the most decisive one, is this: deep sleep, not just enough sleep. Many men think insomnia, restless sleep, or waking up multiple times is simply normal aging. But from the perspective of a urologist, I can confidently say, lack of sleep is one of the strongest drivers of prostate inflammation, faster enlargement, and weakening urinary flow. The reason is simple. During deep sleep, your body releases 2 highly important hormones. Melatonin reduces inflammation. Growth hormone, GH, repairs tissue. At the same time, testosterone is rebalanced while you sleep. When your sleep is fragmented, especially due to nighttime urination, these hormones never reach their required levels, keeping your body in chronic low-grade inflammation. The result: weaker urinary stream, increased pressure or heaviness, more nighttime urination, a more reactive, inflamed prostate. A 9-year study on more than 2,400 men found that men who slept poorly had twice the risk of developing advanced prostate cancer. So, how do you restore deep sleep after 60? 1. Create a golden environment for sleep. Dark, quiet, cool room. Avoid blue light 1 hour before bed. Sleep and wake at consistent times. 2. Apply habit number 1. Smart hydration. If you reduce water intake from 6-8 p.m., you cut nighttime urination by 40-60%. 3. Avoid late meals and sugary foods at night. Sugar increases inflammation and irritates the bladder. 4. A simple 4-7-8 breathing exercise before bed. It only takes 1 minute, but slows your heart rate and shifts your body into relaxation. Real patient story. I once had a patient named Henry, 74, who had nearly lost the ability to sleep deeply for 5 years. He told me, "Emily, I don't think he'll ever have a full night's sleep again. We started with drinking water steadily during the day, reducing water after 6 p.m., taking a 10-minute walk after dinner, and setting a fixed bedtime. 3 weeks later, Henry returned with a face full of energy. He said, "I slept 5 hours straight. I haven't felt my body recover like this in years. This isn't magic. It's deep sleep, and it is the strongest free medicine you have to protect your prostate." Now, to help you not just understand but actually apply everything, I want to guide you through a very simple 4-step routine. If you follow it, within just 2-3 weeks, you'll feel a noticeable improvement in your sleep, your urinary flow, and your overall comfort. Step 1. Start your morning with a large glass of water. Right after waking up, drink a full 250-300 milliliters glass. This helps dilute your urine, reduce bladder irritation, kickstart your day with stronger circulation. Continue drinking small amounts throughout the day until around 5-6 p.m. Step 2. Add a 10-15 minute walk after lunch or dinner. You don't need intense exercise. A simple walk around your home, your yard, or down the hallway makes a big difference. Reduces inflammation, stabilizes blood sugar, nourishes the prostate with better oxygen flow. Step 3. Add one nutrition booster each day. Choose at least one of these 3 groups: cooked tomatoes, a handful of pumpkin seeds, or walnuts, a bowl of cruciferous vegetables. These small additions are natural medicine you can use daily. Step 4. Reset your sleep. Keep your room dark and cool. Avoid screens for 1 hour before bed. Reduce water intake in the evening, and try the 4-7-8 breathing exercise. Apply these 4 steps consistently for at least 14 days. If your body responds slowly, don't worry. Some men need 3-4 weeks, but the results are always worth it. Before we end today, I want you to pause for a moment and truly listen to this. You are not too old. You are not too late, and your body is not broken. So many men over 60 come to me with worry, embarrassment, and even a sense of helplessness. They believe that these uncomfortable changes, nighttime urination, a weak stream, that tight pressure, are signs that they are losing their manhood. But I've witnessed the opposite. Time and time again, when you give your body the right signals, it responds far more powerfully than you expect. Circulation improves. The prostate calms down. Deep sleep returns. And confidence, the kind a man relies on, slowly comes back. I've seen men in their 60 seconds, 70 seconds, and even 80 seconds restore things they thought were gone forever. I've seen them smile again. I've seen them travel, play with their grandkids, sleep 6 hours straight, and live a life they thought age had taken away. And I want that for you. Remember this: age does not take your strength away. Only the wrong habits do. And today, you've learned 5 of the right habits. Habits that can completely change how your prostate functions and how you feel in your body every single day. Your body still remembers how to work. It's just waiting for you to send the right signals again. Before we finish, I genuinely want to hear your story, your experiences, those restless nights, the small improvements you've noticed when applying a new habit, or the relief you felt when nighttime urination started to decrease, may quietly give strength to another man, someone who is confused and anxious just like you once were. Among the 5 habits we discussed today, which one will you start with first? And recently, has your body changed in any way, your sleep, your urinary flow, or the way your lower abdomen feels? A sincere comment from you might be exactly what another man needs to read right now. If you found today's video helpful, please hit like, subscribe, and share it with a family member, a friend, or anyone who may be silently looking for answers. Every interaction from you helps more men discover the truth about their health and regain the confidence they deserve. And finally, I want to remind you of this. This video is meant for education and general health information only. It is not a substitute for personal medical advice. If you're experiencing severe or persistent symptoms, please speak directly with a specialist to get the most accurate guidance. Thank you for spending your time with me today. I read every single comment, and I truly look forward to walking with you again in the next video.